This video is going to be about rotator cuff exercises for pain relief. Pain in your shoulder that's originating from the rotator cuff is actually very common. I see this in the clinic a lot. So I'm going to give you guys some exercises to work on your pain and improve your function. The first exercise is called pendulums. This is an exercise where it's a passive motion for your shoulder. All you're essentially doing is moving your body to help to facilitate some motion in the shoulder. So pendulums have two parts to it. There's one where you go forward and backwards, and then there's another one where you go sideways. I'll show forward and backwards first. So this is mostly a passive exercise, meaning you're not here and then you're moving the arm like this. This would essentially be an active exercise. What you want to do is you actually want to use the body to move the arm. So you're just swinging your body back and forth. You're in a stagger stance like this. You can use the other arm to hold on to something, and then you're just swinging your hips and moving your weight from the front of your leg to your back of your leg. So versus if you're standing still and then you're moving and trying to swing the arm using the muscles of the arm. So we're trying to encourage motion in the shoulder without actually engaging the muscles in the shoulder. So this would be the only way to do it if you're using your body. So you're just swinging. And when I have people do this in the clinic, it's about 10. So when you go side to side, the concept is exactly the same. So I usually hold on to something or have my folks hold on to something, and then you're shifting your body weight from side to side, just letting the involved arm dangle. And as it dangles and your body weight moves, then the shoulder moves with it. Versus if you're standing still and you're swinging it like this. This is essentially an active motion from the shoulder. If you just shift your weight back and forth and just actually let the arm dangle, the arm will have to move with the body. Next exercise is called a table slide. So when you do this, you need a slippery surface. I'm just using a treatment table here along with a pillowcase to help promote slipperiness. This is a passive exercise, so meaning you're not really trying to use the muscles of the shoulder to do this exercise. So to compensate for that, you're using the trunk to move your shoulder forward. So this will help you move the shoulder because your trunk is moving it. And when you sit up, the body is going to move the arm back. Versus if you're reaching with the shoulder, those are two different motions. Mainly because when you do this, the muscles of the shoulder is engaging and turning on. That's not what you're trying to do, especially if you're in the painful state. If you stay passive and just use the trunk, the shoulder will just go with it because it's attached to the trunk. And same thing when you're coming back up. So when you do this, I usually have my folks go for about 10 seconds, holding it as far as they can. And then when you sit up, you resume, and I have them redo this about 10 times. The second portion of the table slides is going out into the abduction direction. So this was flexion, and going out this way is abduction. Usually this way is harder, and by harder I mean it's a little bit more discomfort or sometimes a little bit more painful. So adjusting the angle here matters. So a straight out to the side is where it's usually the most provocative for the shoulder. And if you're in the state where your shoulders have a lot more pain, it engages more muscle, so it's going to be a little bit more painful or discomfort. So you modify the exercise by angling it, meaning you don't go straight out into a flexion, you kind of go out into a diagonal, and then maybe this feels okay. So if that feels okay, you go out a little bit closer to the straight abduction direction. If you go out this way and that's too painful, then you just back it off a little bit. The concept is the same. You keep it passive. You reach out with the trunk so the shoulder moves with it. And when you come back and sit up, the shoulder comes back because it's attached to the trunk. Versus you reaching out and then pulling back, reaching out, reaching back. Again, that would be an active motion. The concept is the same here in terms of the parameters. You reach out, hold it for 10 seconds, and then you pull back with the trunk, and then you repeat for 10 times.
So the next exercise is shoulder flexion with a stick.
So you can do this with a broom at home, or if you have a cane laying around, you can do it, or really just any stick that goes with it. So the idea behind this is similar to the table slides, but it's active assisted because you're using some of the muscles on the right shoulder instead of none of them. And then the left arm is still driving the motion, but you're just assisting with the right arm. So the right arm is the involved side. This is the side that's hurting. So what you do, this is how the exercise looks like. You're using the left arm to move the stick, and then the right arm's just gripping on, and then it just goes with it. So you're bringing this up as high as you can go, holding it for about 10 seconds at your threshold. So your threshold would be when pain starts or when you feel like a stretch. 10-second hold is over there. That's where you hold it at the threshold, and then you bring this back. Even when you bring it back, your left arm is really doing most of the work, and your right arm is just assisting this motion. And you do this for about 10 times. The next thing we're going to do is work on external rotation of the shoulder. That's usually what's lacking when the rotator cuff is injured or it's involved in some kind of pathology. So when we're working on this, we're using the stick. This is, again, an active assisted exercise, meaning you're helping with the right shoulder, but you're not doing most of the work. It's the left arm with the stick that's doing most of the work. So you position it right. So the exercise looks like this. You use the left arm again to do most of the work, push it out into what we call external rotation. Get to the point where you hold it there for about 10 seconds. Or if it's painful, then you back off a little bit, and then you hold it at the point where you can tolerate it for about 10 seconds, and then you bring it back. So your right arm again is just holding on. You're going out. You want to be in this position about 45 degrees out. So if this is 0 degrees, this is 90 degrees, and this is about 45 here. You want to prop your shoulder up or your elbow up here with a little bit of a towel to bring it close to somewhat of a scaption position. That is the optimal position for the shoulder, and that's where you want to start the exercise. So you want to maintain that angle while you are doing the exercise, pushing into external rotation, and then you come back. We're going to go and progress into some gentle strengthening with some isometric exercises for the shoulder. So again, the right side is the involved side. What you essentially need for four-way isometrics is just a little bit of a towel here. You can take a shirt, fold it, put it underneath the armpit region, so then you can just rest that here. You want a little bit of space, mainly because that's where the optimal position is for the shoulder. So we're going to go for 4 directions. We're going to go for flexion, we're going to go for external rotation, internal rotation, and then extension of the shoulder. So all of these motions in full is flexion, internal rotation, external rotation, extension. Because we're doing isometrics, we are really just keeping that in the same position. So you're trying to go in those motions, but then you're not. So the exercise looks like this. I usually have my folks do this about 10 seconds of a push and then 10 reps. So flexion looks like this. You're just pushing in. That's all you're doing. It's about a 50% effort. So you're really trying to do this, but because the squat rack's here, it's in the way. So you're engaging similar muscles in which would help you do this, but it's just the shoulder is in a neutral position. So if you're in a state where the shoulder is painful, this is a really nice exercise just to help engage, but without actually moving the shoulder. 10-second holds, and you repeat for 10. External rotation, again going out this way, but you have the towel here for better positioning. So you're going out into the squat rack, 10-second holds, and then you would do this 10 times. Again, it's about 50% effort. You come over here, you go into internal rotation, you just push in. So you're really trying to do this, but again, the rack's in the way. 10-second holds, 10 times, and then extension. So extension is this, but if your elbow's here, extension of the shoulder is here. So this and this is all the same thing because you want the point of reference is here. So you turn around. Actually, I'll do it on this side for the sake of the camera. And then you push back. So I'm really just trying to do this. Just trying to engage the muscles that help me go into extension. 10-second holds, 10 times, 50% effort. The last exercise is a scap squeeze or shoulder blade squeeze. So essentially what you're trying to do is you're just pulling and drawing your shoulder blades back, and you're holding that for about 10 seconds, and then you're repeating for 10. So you're just squeezing your shoulder blades together, straight back, 10-second holds, 10 times. Make sure you're not shrugging your shoulders when you're doing this, because then you're engaging some of your upper traps when you do that. And if you do that, you're not really engaging the proper muscles to help align the shoulder blade. 10-second holds, and then 10 times. So none of this stuff. You want to go back, so I'll do it on the side. That's essentially what you're looking for. So you want, if your head of the humerus is sitting forward a whole lot, you want this to draw back, mainly for posture and alignment of the shoulder. So if the head of the humerus is in a good position, it's also better for the rotator cuff, so they won't create any imbalances. And then relax. 10-second hold, and then relax. These are some of the exercises that I give my patients when they come to see me when they're in a lot of shoulder pain because it's originating from the rotator cuff. We do these exercises for a couple weeks, manage the pain, bring it down, and then when they're ready for strengthening, then we progress the program and move that forward. I'll do another video on strengthening of the rotator cuff specifically, so just look out for that one. That's all I have for you guys. If you guys have any questions, please leave them in the comment section below. Other than that, I'll see you guys in the next video. Thanks for watching.